Baja California, frontera de turismo de salud, the health tourism border. Hi, I'm Dr. Ariel Ortiz Lagardere, president of the Mexican Board of Health Tourism. What makes Baja California so special? Well, when you look at geography, it's all about location, 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 and Baja California has it all. It's right in the middle of two of the most important countries in North America. When we talk about health tourism, it's important to distinguish that there is a national travel inside the countries, but more importantly, we will be talking about the international aspect of health tourism. How large is this market? Well, in 2020, it was considered that the wellness market globally is a $436 billion market. When we break it down globally and we look at North America shares 33% of that market, a third of that market, with Mexico having an astounding $4.5 billion market in 2018. Not only is it an extremely large market, it's growing, and projections to 2030 are around 13.3%. Now, what makes us experts in Mexico, in Tijuana? Well, I'm the director of the International Institute of Metabolic Medicine, where the medical sciences, biotech, bioresearch, and bioindustry become our partners and alliances. They come together to join forces in advancing medical care. We have been performing weight loss surgery for the past almost 30 years. We're fully accredited by 5 international quality accreditations, like Joint Commission International, Global Healthcare Accreditation, ISO. We've done almost 30,000 procedures in the past 30 years, mostly on US and Canadian patients. And our numbers are growing. So if in Mexico we're growing, what's happening in the United States when looking at weight loss surgery, because that's what we specialize in? Well, if you look at these numbers published by the American Society of Bariatric Surgery, in 2018, their numbers were kind of stagnant. They grew very little, but by 2020, you can see that the numbers diminished. So something is happening in the United States where the numbers of procedures are decreasing, while in Mexico they're increasing. What could it be? So let's look at the drivers. When we look at the drivers, of course, it's the availability of care, the cost of care, the timeliness of care, the quality of care, of course, the destination, and additional perks that stimulate the traveler. What could be some obstacles for the patient to travel? Well, geography, doubts about quality and safety and the continuity of care back when they're in their country, and certain medical legal uncertainties. All these have been considered in the literature in the United States and Canada. So what do we agree on so far? Well, we agree that it's a growing market in Mexico, especially in Baja California, especially in Tijuana, and that the numbers of procedures are decreasing or plateauing in the United States. Now, I do want to call your attention to this, that we consider a new modality in health services, which is medical services plus hospitality. And we will talk about this in the next few slides. Now, of course, there's concerns. And these concerns come basically in the form of organizations in the United States, like the American College of Surgeons, the Society for Bariatric Surgery, the American Medical Association, even the CDC, and they have concerns about complications, results, and follow-up. So how has Mexico confronted this concern? Well, let's look at it. As we were saying, there's a new modality in healthcare. Mexico has become an expert in this new modality, which is not only excellence in the medical services, but hospitality, which equals a better patient experience. But let's concentrate on how we can guarantee excellence. Now, as you have recently heard, Mexico, especially Baja California government, has created a very unique accreditation, which validates the organization's 100% compliance with healthcare regulations. This guarantees quality and safety from a regulatory standpoint. Okay, so the government has created this unique model for quality and safety, which should be replicated all across Mexico, thanks to our governor. But what do we do now? What do we do with this? Well, why not combine it with the efforts of private sector and the Mexican Board of Health Tourism? What is the Mexican Board of Health Tourism? Really simple. We promote, educate, and facilitate third-party world-class quality and safety accreditations. Much like we've already mentioned, the Joint Commission International, GHA, all these are third-party accreditations that increase the quality and safety in health tourism industry in Mexico. So what could be the best ideal partnership? Well, the efforts of the government in Baja California with the RIPSAVI accreditation, plus world-class quality accreditations promoted by the Mexican Board of Health Tourism that will result in quality and safety. I should know, we built a hospital that's considered the gold standard in health tourism. But not only us, there's several players, large players, seeking to become part of this industry in Baja California, and several hospitals opening their doors to meet the demands of the traveling patient. And I want to end this presentation on a high note. From a historic standpoint, Baja California will become the first state in our country to establish a historic cross-border partnership. The International Institute of Metabolic Medicine has signed an agreement with the University of California, San Diego, to start treating patients across the border. We are becoming, because of quality and safety, because of our international status, because of our long-standing record, the first cross-border health services provider that has been accredited, verified, and contracted by an international healthcare provider such as UCSD. We applaud the efforts of our state government and their vision, plus the healthcare industry in Baja California, which has established themselves as the leaders in health tourism globally. Thank you for your kind attention.